So for me, I grew up in Northern Ontario, in Sudbury in the 1970s, which actually was a great place to grow up. But as you can imagine, there was no internet, there was no Google. So, you were sort of restricted to the world that you lived in, a very small bubble of your street, your friends, your family. So for me, I always knew that I felt differently. And I think it really only strikes you that maybe something is different is when you go to school, right? For the first time, because at school, especially in those days, people were very gendered, right? There were boys and there were girls. And if you were a boy, you were on the boys' side. If you're a girl, you were on the girls' side. There were boys' bathrooms and girls' bathrooms, which didn't exist at home. And so it was very clear that you were expected to play a certain role depending on what gender you were assigned. So for me, that was sort of like right in my face, especially when I didn't necessarily feel that way. But you learn pretty quickly that's not something that you can tell other people because other people aren't going to react as well as you think they might to telling them that. And so really the first time I ever sort of, understood what the term transgender or transsexual, which was the term they used in those days, was when I was watching a documentary on the CBC with my father. And ironically, my father's also a physician. And, at that time, there were 2 TV channels and you actually had to get up to change them for the younger crowd. But so I was watching this documentary about Renee Richards, who was a trans woman, also an ophthalmologist from New York City, who was playing women's professional tennis, and of course, obviously, was quite controversial at the time. And I remember looking at that and sort of the light bulb going off. Go, well, first of all, I can do that, and secondly, that's me. And of course, so then I assumed, because you can imagine, you have no internet, you have no access to anything. I thought there were 2 people in the world who felt that way: me, this little kid in Sudbury, Ontario, and then this really famous tennis star physician from New York City. So in some ways it was liberating, but in some ways it was quite scary. So then, being the child that I was, I then looked it up in the Google of the 1970s, which is otherwise known as Encyclopedia Britannica. And again, for the younger folks out there, if you go down to your parents' basement, you'll actually see Encyclopedia Britannica covered in dust. So I took it out and I looked up the term transsexual because that was the term that was used at that time. And of course, the article was actually really quite negative, quite transphobic, and really didn't give you a lot of hope that you would have a bright future being a transgender person. So again, that sort of makes you think, well, I really can't tell anybody this. And again, if I did tell anybody, what would actually happen? Well, they'd probably send you to see a psychiatrist and nothing else would happen. You'd try and fix you, so to speak. And so then you go through puberty, and of course, puberty is incredibly uncomfortable when you have gender dysphoria because everything's happening to your body that you wish wasn't happening. But again, there's nothing, or you don't think there's anything you can do about it. So again, in our high school, if you said anything about who you were, it was just a one-way ticket to bullying. So you just keep it to yourself. And then, you also have other life goals. And my other life goal was, I think to succeed and to go to university. So then I, went to university, worked really hard, and achieved my goals from an academic, personal perspective in that regard. And then you go and do a residency, and then, you start your professional career, and life gets busy. Gender dysphoria is there with you the whole way. It's like sitting on your shoulder. It's always there. It doesn't go away. It doesn't get less. It gets, in fact, more intense over time. But still, even then, you were thinking, if I come out, that's a career killer. So there's sort of these competing forces, right? I want to be my true self, but at the same time, I also want to actually succeed in society. So this was something that was a constant war in my mind. But ultimately, I guess, you have to be who you are. And so ultimately, I made that decision. I remember going to my chief at the time and saying, listen, here's the deal. And of course, you're really nervous, right? Because you don't really know how people are going to respond. And my chief said, well, why would you leave? I'm like, well, because of this. He goes, well, that's not a reason to leave. He said, I think you should stay. I'm like, okay. In fact, I want you to stay. I'm like, okay. And then I went to talk to the chief of staff and the president of the hospital. And they also said to me, well, you're one of our valued doctors at this hospital. We don't think that's a reason to leave. So I think you should stay. I'm like, cool. And so I'm like, okay, well, maybe I will stay. And then, I would disclose to some of my colleagues in the department who were good friends, particularly in the nursing staff. And they were all like, yeah, there's no reason for you to leave. We'd hate it if you left. I'm thinking, well, this is kind of cool. So at one point I decided, well, I have to tell everyone that this is going to happen. So we had this big meeting, and literally like the entire department showed up. I think they thought I'd won the lottery or something. That was a rumor. And like, no, that definitely wasn't a rumor. So then I disclosed what, was going to happen. And, even some of the nurses that I knew who had moved on from Merge came down for this meeting. I'm like, oh my goodness. And so but at that meeting, it was nothing but kindness and support and empathy. And so I felt, wow, this is really, really kind of crazy. And so, here I was, this doctor who was getting all this support from the entire hospital, security guards, people in food services, rad techs, nurses, cleaning staff, just everyone. It was really, really impressive. So, I think ultimately that made the decision I would stay at my hospital. And I knew I'd sort of really made it when one of the surgeons, one of our really old, tough surgeons, came up to me and say, don't let everybody give you a hard time because I got your back. So I'm like, wow. Huh. So I was really, I was like, okay, I can do this. So I actually did it. And, I went on to be president of the Medical Staff Association at my hospital. And, except for the occasional name or gender slip up, which is understandable for people who worked with me for decades, it's been a really smooth and supportive process. I have to say I'm very fortunate. What we see when people transition is that their mental health often improves significantly. So we see lowered rates of depression, we see lowered rates of anxiety, lower rates of suicidal behavior and ideation. If nothing else, from a mental health perspective, things improve, but also just the freedom of being yourself is actually a really cool experience, because it's like gender dysphoria goes away. Not entirely, but you're freed up. All this mind space that was taken up with these feelings are suddenly freed up, and it's like, whoa, I can process more. And it's really hard, I think, for people who aren't transgender to understand gender dysphoria. So I try and describe it this way to the less gifted people out there, less gender gifted. So what I say is, again, this is an older reference, so for the younger crowd, just ask your parents. But when you were a kid and you were traveling somewhere and you had your favorite radio station on, and you're driving with your parents, you're in the back seat, and you're listening to a song that's really cool and you love it, but then suddenly you start to lose the signal and it goes out of tune. It's really annoying, right? But you also love your favorite song. So you don't know what you should do. Should you turn to another channel, or should you just keep listening? And so I describe gender dysphoria like that. It's like you're just always slightly out of tune. It doesn't mean that you can't necessarily live your life. It doesn't mean you necessarily can't function. But you always have that static and that annoying noise that you can never get rid of. And the way to get rid of that is to be in tune. So for me, the really cool part about transition is that now you're in tune. And so I think that's a really great feeling. Just think about this. Nobody ever questions who you are. Nobody ever says to you, are you sure that's who you are? Maybe give it some time and you'll change your mind, right? People assume that that's just absolutely 100% who you are. But when a trans person comes out and says, a boy or a girl, depending on their age, says to their parents, I think I'm transgender, or I think I want to be a girl, I think I want to be a boy, suddenly it's like, whoa, slow down here, buster. Maybe it's just a phase, as if somebody's identity is a phase. Maybe, let's just wait and see. Meanwhile, this child or young person is suffering from gender dysphoria and having intensity of feelings that lead to depression, anxiety, and suicidal behaviors, drug use, homelessness, and all these really negative outcomes that we know occur from untreated gender dysphoria. And they have to sit and wait. And maybe while they're sitting and waiting, and their parents say, well, you need to go see a psychiatrist or a therapist. And suddenly you're now being told, clearly there's something wrong with you, because they didn't send my brother, who's heteronormative and cisgender, to see a psychiatrist to make sure that was his true identity. But they send you to see a psychiatrist to make sure it's your true identity. So when you actually think about that, that's where the pathologization starts. Because when you actually think about it, if anybody in the room today stands up and says, I'm transgender, nothing happens to you, right? You don't go blind, your lungs don't fail, your heart doesn't fail, your kidneys don't fail, you don't develop arthritis, transgender-related arthritis. So the pathologization doesn't come from who you are, it comes from everybody else's external beliefs and actions upon you. So that's what I'm talking about when I'm saying we should depathologize trans identity, because no one's, and I repeat, no one's identity is an illness. Well, I always think I mean, I'm one of those sort of old school people that thinks, how you treat the least of us represents who we are as a people. And so when we treat transgender people poorly, or really any marginalized group poorly, I think it reflects on our society. And then I think as a society, our goal shouldn't be to meet the needs of the majority, because the majority's needs are often met because just by being part of the majority. And so we have to think about people who maybe aren't part of that majority, and how do we include them? It doesn't mean, that people in the majority don't matter. I think that sometimes people in the majority feel that maybe it's because they don't matter, but everyone does matter, and which is actually the quote in our community health center: everyone matters, but everyone does matter. And so what it means when you're talking about being more inclusive and more diverse, it just means bringing everybody in to that pool and allowing everyone the same opportunities to succeed. And it's not easy. It's sometimes can be difficult. It sometimes can be scary. It can sometimes be something that you don't want to do. But at the end of the day, what the great things about diversity is you can go down the street now and eat curry. You can go down the street and eat roti. So there's lots of great things about diversity that we all love. And we just have to think of it in that regard, that it's not going to make our society poorer. It's only going to make our society richer. So my clinic is actually located in St. Catharines. And it's an interesting story because why that happened was it was a new community health center that had been built, and one of their priority populations was LGBTQ folks, because nobody had done that care in St. Catharines. And so I remember meeting the program manager and the health promoter at the time at the very first Rainbow Health Ontario conference, very, very first. And we were in the same LIN, so that's how we got together. And so I remember talking to the program manager, Jenny, who's still the program manager today, and she said, "Would you be interested in doing a clinic?" I'm like, "Yeah," because you just say yes, right? I mean, you never say no, you just say yes. But I thought I'll never hear from them again, It was a nice idea. So I gave, Jenny my email address. And about 2 months later, her and the executive director, Coletta, emailed me and said, "Would you want to come meet with us and talk about this?" I'm like, "Yes, I would." So I drove down to St. Catharines, got lost several times because I'd only ever driven through St. Catharines, never actually been into St. Catharines. But I finally found where they were located. And it's right across from the old St. Catharines General, for those of you that are from the Niagara region. And we talked, and they basically said, "What do you want to do?" I said, "I just want to make, transgender healthcare accessible. I want to make sure that patients can refer themselves. They don't have to rely on a doctor to refer them because, some doctors are not so positive about trans people. And I want to be able to take people from anywhere, which is not usual for a community health center. But because we recognized the need was so great, that they allowed me to do that. And then we just started in 2010, I believe I started the clinic, September. And just never advertised, just all by word of mouth. And so now today, we have a whole team that helps run the transgender program. We have another physician, also an emerge doc, the coolest, and a nurse practitioner, Nazila, who's amazing, fantastic, the coolest Iranian woman you'll ever meet. And the three of us, along with our nursing staff and therapists, social workers, outreach workers, we run this trans clinic that has over 1,000 patients. And it's pretty amazing, I have to say. So my youngest person I've ever assessed is a 4-year-old, and the oldest person I've seen is 82. And they present because they want to tell you who they are. And I just sit and listen, and then we make decisions, after that. So at our clinic, we are able to provide, non-pathologizing care. So we allow people to use preferred names, preferred genders. It shows up on our chart. We still have to use the name on their OHIP card in order to get paid, but that's just the reality of the system. But, we provide trans-sensitive care. Those of us that see trans people, we don't pathologize them. We don't judge them. We have gender-neutral bathrooms. All our staff from the front office right to the back and back out the door again are trans-sensitive. And then, a lot of people like to come to see me because they know I get it, right? They don't have to justify who they are. And I think that's a great comfort for a lot of people. I always, call the very first visit the sweaty palm visits because people are so nervous that they're going to have to prove they're transgender, right? And I always say, you don't have to prove anything to me. Just tell me who you are, and we're going to, help you meet your goals in a safe, medically appropriate way. And I think that's what most doctors should do. Stop trying to figure out if you're going to make a diagnosis. Yes, you have to have a diagnosis on your chart. I understand that. And you can, put down gender dysphoria, which is the actual diagnosis. But at the end of the day, your role as a physician or nurse practitioner or nurse is to help that person achieve their goals in a safe way. And I think what's really great about trans care is that patients are really grateful, which is not always the case these days. you see this person blossom as a human being into their true selves. And, quite frankly, most of them are really young and healthy, so they're quite easy to take care of. I mean, trans care is really, really easy. It's not hard. It's not complicated. I do far more complicated things every day in the emergency department than I ever do in terms of cross-gender hormone therapy. It's not hard. And so at our clinic, we provide care from start all the way through medical, then surgical transition. We don't do this. The only thing we don't do is the surgeries, but we tend to do all the post-op care, we do all the pre-op care, we do all the hormonal care, and we help people through transition. So it's a really rewarding job, and I would certainly recommend, if anybody's interested out there, that it would be a really great career, and you'd love it. You'd absolutely love it. So I would point out to the Ontario Nurses Association that the very first big paper ever published was published by ourselves with Ontario-based data. So if you think it's something like Alabama's problem or Alberta's problem, it's not. It's everyone's problem. And so the way that you basically ensure that transgender people feel comfortable coming to your emergency department, or choose not to avoid your emergency department, or really any healthcare setting, it's actually really, really simple. It takes really no effort. Somewhere in your chart, you have room for a preferred name. Somewhere in your chart, you have a room for preferred pronouns. Somewhere in your chart, you have room for preferred gender. And you respect it. You just talk to that person. And you know what? You don't need to know what surgeries they've had unless it's relevant to the presenting medical complaint. So you don't need to ask that question. But if you project empathy, kindness, you recognize their identity, use the right pronouns, don't look shocked when it's a little bit incongruent. If you do that, that's really all it requires, because everything else in terms of healthcare is just healthcare. There's no such thing as a trans strep throat. There's no such thing as a trans kidney stone. They're just strep throats and kidney stones. So everything else you do is within the context of normal practice. It's just that idea that respecting their identity. And if you do that, you've really done 99% of the work. Honestly, it really is that simple. Well, again, I think when it comes to transgender populations, it's not that different from any other marginalized population. So in all groups that are marginalized, you see increased rates of addiction, smoking, self-harming behaviors, depression, anxiety, because it's, again, nothing inherently pathologic about being that person. It's the way the rest of the world treats you. And so I think one of the more interesting things that we see with trans people, especially with trans youth, is that they have supported transition. Their rates of depression go from 80% to 18%, which is about the same as the general population. The risk of suicide goes from about 45% to about 4%, which is a little bit higher, but about the same as any other LGBTQ population. The risk of homelessness goes from about 50% to 0. And again, just to let you know, that's Ontario data. That's not, again, from some other jurisdiction. That's Ontario data. So we know that supported transition, access to healthcare, and having a legal right to exist are things that actually make transgender people healthier. And so we've done a lot of that work legally, in a sense, in this province. I mean, gender identity expression is a protected human right in Ontario. We don't allow reparative therapy in children in Ontario. We have access to healthcare that's improving for trans folks. We have access to translated surgeries. So we have improved, but again, making the leap from law to actual real change on the ground takes time. So I think all of us together, we can, be part of the solution rather than part of the problem. Again, for me, when I talk to people, particularly to healthcare providers, nurses in particular, I think the take-home message is be kind. Be empathetic, respect people's gender identities and pronouns. How really hard is it to use the right pronoun? It's not hard at all. It doesn't require any major relearning. You just have to respect it. And if you use the right pronouns, you use the proper name, you're actually going to make healthcare better, and you're going to make the experience for those folks who use your healthcare system much, much better. And that's a win for all of us. And at the end of the day, being a transgender person is no different from being a cisgender person. We're just living our lives just like everyone else.